Now, there is always something to worry about when it comes to your children. And as a new mom myself, the information concerning allergies can really be overwhelming. Thankfully, the experts at Ohio ENT and Allergy physicians are dispelling some common allergy myths so we can all rest a little easier. I'd like to welcome Dr. Roger Friedman, so thanks for being here.
My pleasure, Robin.
So let's get right into these myths because we have 6 that we're going to go through today.
Sure.
Myth number 1, young children can't be allergy tested.
That's a myth that has been going on for decades and decades and decades. And it's even taught in medical school, and that's why so many doctors don't know the right answer. It used to be thought that you couldn't allergy test a child until they were 2 or 3 or 4 or 5 or some mythical age.
Sure.
But in fact, you can do allergy testing at virtually any age. I always say jokingly that, the only thing I need to test a baby is a back. If we have a back, I can test them. But what's confusing to some people is that allergy testing will be very accurate when you do it, but the immune system can change. So if I allergy test a baby at 6 months or a year or 2 years, it doesn't mean they can't become allergic later on. Of course they can, but it's very helpful when it's important to know information, especially related to foods, that we can do it very early in life.
Exactly. You want to have as much information as you can.
Knowledge is the key. Knowledge is power, to let parents know what to do and let doctors help guide you.
All right. Myth number 2, EpiPens are scary.
Yeah. As you know, we're in the midst of an epidemic of peanut allergy right now. And actually, we're going to talk a little bit maybe about ways that we're going to prevent that in the future. But right now, we're having 2% of the population have peanut allergies and about 8% have food allergies. What's so important to understand is that the one treatment that saves lives, that makes a major difference in whether a child or any patient will live or die, is the use of an EpiPen.
Sure.
EpiPens are life-saving. They don't hurt. They work very well. There's virtually no confounding variables. It works. It saves a life. And people are so scared, oh, I don't want to give the EpiPen. I want to give Benadryl. Well, the problem with Benadryl or antihistamines, they only treat mild symptoms like skin problems, and those are not dangerous. The dangerous problem is when it involves the airways, when you can't breathe, when you have asthma or airways or cardiac events, and the EpiPen is so simple to use and so safe, and you should never think twice about it.
All right, and so effective, obviously. So
very effective. It works 99% of the time.
All right, doctor. Myth number 3. I feel like I've heard this a lot recently, especially since becoming a mom. Avoiding foods early in life can prevent allergies.
Yeah, so it's been a confusing factor that we've had more food allergies. And so we've struggled with trying to figure out what can we do to help moms and to help young babies. And the American Academy of Pediatrics, in their good judgment about 15 years ago, said, well, maybe what we should do is avoid the early introduction of highly allergenic foods, milk and egg and fish and nuts and peanuts.
Sure.
And if we would wait until they were 2 years of age, maybe that would help prevent it. Well, it turned out that was the exact wrong answer. They realized that, and they changed their guidelines. But that message hasn't always gotten out to everyone. And so what we now realize is that, in fact, in the high-risk babies, and a high-risk baby is a baby who comes from a family with food allergies, or a baby who has bad eczema, or a baby who has documented egg allergies at an early age, that what we do with those babies is we see them in the first 6 to 11 months of age, we allergy test them to nuts and peanuts, and in fact, if they're negative, we start them on a peanut diet. And by starting them on a peanut diet at that early age, we actually can reduce the incidence of peanut allergy by 85%.
Wow.
So again, the early introduction under careful guidelines. You
Sure.
don't want to just do it at home. Now, if you've got no risk in a baby who has no risk of allergies, you can certainly start introducing these foods earlier, not later. Again, I'd recommend you talk to your pediatrician, talk to your family doctor and primary care physicians about when to do things. But we know that avoiding the early introduction is not the answer.
Okay, let's move on to the next. Sinus symptoms always need antibiotics.
Yeah, so many of our patients will complain and say, oh, Dr. Friedman, I think I've got a sinus infection. I need antibiotics. And many times they'll call after they've had a headache for a day or 6 hours even. And so much of the time, sinus pressure and pain may not be infection. It may be inflammation from other reasons. It may require a doctor visit to help decide. But many times, even patients with sinus infections don't always have to be on antibiotics. And we're trying in medicine to use less antibiotics. And it's much better to be evaluated appropriately. And sometimes you'll see the ear, nose, and throat doctor to be looked at, to look down the sinuses and look at the sinuses to know if you need antibiotics. But again, we're trying to avoid the overuse of antibiotics in those cases.
Okay, Dr. Friedman, got about 30 seconds, so we're going to quickly get through the last two. The one, some believe people who are allergic to eggs can't get certain vaccines.
Yeah, for a long time, if you were egg allergic, you could not get the influenza vaccine. We've now done lots of studies, lots of data. That's not true. You can get the influenza vaccine, very important to prevent flu, and almost every child or patient who has an egg allergy can receive it. You may need to talk to your doctor about it, but almost everyone can receive it now.
Okay, good to know. Lastly, most people outgrow asthma.
Yeah, the majority of people who have significant asthma, who have true allergic asthma, I say jokingly they outgrow their pediatrician. Because they may get better for a period of time, but when they get to be older in their 20s and 30s, they may have symptoms once again. Most of our patients with asthma can be well maintained, well controlled, with good medications, with allergy shots if they're needed, with avoidance of allergens, but many of them will continue to have problems throughout their entire life.
Dr. Friedman, great information. They can find you, Ohio ENT and Allergy Physicians. We have the website, the phone number up on screen, so thank you.
Thank you so much, Robin.